During a hospital audit, nurses may be asked specific questions related to the hospital's internal policies, procedures, and practices. These questions typically focus on the nurse's understanding of and adherence to the hospital's specific protocols, regulatory compliance, and patient care standards. Here are some tips for responding. Know your policies. Familiarize yourself with the hospital's specific policies, procedures, and protocols. Ensure that you can describe how you apply them in your daily nursing practice. Be honest. If you're unsure about something, it's okay to admit it and let the auditor know that you will seek clarification or further training on that topic. I could ask my charge nurse. Provide examples. If you're asked how you handle specific situations, be ready to provide concrete examples from your experience. Here are some areas where you may be asked hospital-specific information. Auditors may ask about the hospital's internal policies and how well you follow them in your practice. They may ask, can you explain the hospital's policy on infection control and how you implement it in your daily practice? Or, what is the procedure for administering blood products here, and how do you ensure patient safety during this process? Or, can you describe the hospital's policy on patient identification before administering medications or treatments? You may be asked about the hospital's protocols related to patient assessments, care plans, and interventions. How do you develop and document care plans for your patients? What protocols do you follow for managing pain or other critical symptoms in patients? Can you explain how the hospital's fall prevention protocol works and how you contribute to its implementation? Auditors may ask about the hospital's specific safety programs and your role in ensuring patient safety. They may ask, how does the hospital handle patient safety reporting, and how do you contribute to the process? Or, can you describe the hospital's approach to preventing and managing patient falls? Or, what steps does the hospital take to ensure safe medication administration, and how do you follow these procedures? Hospitals often have specific medication policies, especially related to controlled substances, high alert medications, and medication reconciliation. They may ask, what is the hospital's policy for handling and disposing of controlled substances? Or, how do you perform medication reconciliation, and how does the hospital ensure this is done consistently? Or, can you walk me through the hospital's medication administration process, including how you verify the medication and dose? Hospitals usually have specific procedures for using EHR systems to document patient information, and auditors may check your familiarity with the system. They may ask, how do you document patient assessments and interventions in the electronic record? Can you describe how you use the electronic record to communicate with other healthcare team members? What steps does the hospital take to ensure that the EHR system is secure and that patient data is protected? Hospitals often follow accreditation guidelines from organizations like the Joint Commission or the Centers for Medicare and Medicaid Services. Nurses may be asked about how the hospital complies with these standards. They may ask, how does the hospital ensure compliance with infection control standards set by the Joint Commission? What is the hospital's policy on patient rights, and how do you ensure these rights are respected in your care? Or, can you explain how the hospital conducts quality improvement initiatives and your role in them? Hospitals typically have specific emergency protocols in place, and auditors will want to know if you're familiar with these procedures. They may ask, can you describe the hospital's disaster preparedness plan and your role during an emergency? Or what are the hospital's protocols for responding to codes, e.g., code blue, code red, and how do you contribute to those situations? Or how does the hospital ensure staff is prepared to handle emergencies or natural disasters? Next, hospitals have strict infection control protocols to prevent healthcare associated infections. Nurses are often directly responsible for following these protocols. They may ask, what steps does the hospital take to prevent hospital-acquired infections, and how do you follow these practices? Or, can you explain the hospital's procedure for handling isolation precautions for patients with contagious diseases? Or, how do you ensure proper hand hygiene and use of personal protective equipment, PPE, in your practice? Hospitals often have specific requirements for ongoing staff training and professional development, including mandatory courses and certifications. They may ask, what ongoing training does the hospital provide, and how do you participate in these opportunities? Or, how does the hospital ensure you're up to date with the latest clinical practices and safety protocols? Or, can you explain how the hospital tracks and ensures nursing staff compliance with required certifications? Hospitals have protocols for ensuring that patients' rights are respected, and nurses play a key role in patient advocacy. They may ask, how does the hospital support patient autonomy and informed consent, and how do you implement this in your practice? Can you explain the hospital's procedure for addressing patient complaints or concerns? How do you ensure that patients' cultural and personal values are respected during their care? Infection control is a top priority in hospitals, and you may be asked about the hospital's approach to sanitation and cleanliness. They may ask, how does the hospital ensure that infection control protocols are followed, and what role do you play in this? Or, what is the process for disinfecting patient equipment and rooms? Or, how do you handle and dispose of contaminated materials like needles and other sharps? Hospitals typically have specific procedures for reporting adverse events or near misses. They may ask, what is the hospital's protocol for reporting adverse events, and how do you contribute to this process? Or, can you walk me through the steps you take if you notice an error or near miss in patient care? Or, how does the hospital follow up on incident reports to ensure patient safety is maintained? By being familiar with hospital-specific protocols and demonstrating your adherence to these standards, you will be better equipped to handle questions and demonstrate your commitment to high-quality patient care during the audit.